Dental unit waterline testing and maintenance. Are you doing it? Let's talk about it. Hey everybody, Benco Bob here. Have you ever had a patient say that the water that came out of your handpiece, your air water syringe, tasted funny or smelled funny, or if it looked like this? Minus the alligator, of course. If the answer is yes to that, then there's a good chance that you have a biofilm problem in your dental unit. What is biofilm? Biofilm is a thin, slimy film of bacteria that sticks to moist surfaces, such as those inside the dental unit water lines. Biofilm occurs in a dental unit water line because of the long, small diameter tubing, low flow rates used in dentistry, and the frequent periods of stagnation. As a result, high numbers of common water bacteria can be found in untreated dental unit water systems. A few disease-causing microorganisms found in the untreated dental unit water includes Legionella and non-tuberculosis mycobacterium. So how do you know if you have biofilm? The only sure way is to test your dental unit water lines on a regular basis. ProEdge has the quick pass test, which is very simple and easy. You do it in your office. It's inexpensive, and you get accurate results. You get the results in 48 to 72 hours, but it's very simple to do, and it's really the only sure way you know if you have a biofilm problem. Think of it as CYA, cover your assets. You can also think of it as a very inexpensive insurance policy. Test regularly, keep a log, and cover your assets. So as a bonus, I am going to do your first test free in the month of June. Next time I'm in your office, just ask. I will test your water line. You'll get the results in 2 to 3 days, and then we can discuss them. If you have an issue, we have solutions for shocking and maintenance, and we can help you get back into CDC compliance. As far as maintenance is concerned, you have a couple of options. You can use tablets or you can use straws. I prefer the straws since they are on all the time, and you don't have to have anybody remember to put a tablet in the bottle every day. ProEdge makes the Blutube. Comes in a box of 2. They're good for 6 months. Once you connect them up to your water line, you can just forget about it for 6 months. At the 6-month point, you'll get a reminder. You shock the system and put the second straw on, and you're good for another 6 months. Yes, the other manufacturers claim 12 months, but studies have shown that the efficacy of the active ingredient diminishes at about the 6-month period. So the best part of this is that ProEdge and Benco Dental have an exclusive promotion through the end of June. Buy 2, get 1 free on either the Quick Pass tests or the Blutube straws. You can't beat this deal. If you're a Dentapure or Stericyl user and you're thinking about changing, now's the time because you're going to save a ton of money. And that's money that's going to probably go into your gas tank. Just remember, I am going to test your water for free in the month of June. And if you would like to take advantage of the buy 2, get 1 free on either of these items, just let me know and we can add it to your next order. If I'm not the Benco rep in your area, please reach out to me and I will find the friendly Benco rep that is in your area. Thanks for watching. Have a great day.